Assalamu alaikum wa rahmatullahi wa barakatuh, esteemed viewer at MTA Africa. You're most welcome once again to your program, Healthy Check, a program where we share with you some medical advice that benefits you. And in today's program, we're going to discuss about the eye, still just like in the previous episodes. Well, it is said that we have around 5 senses, which I'm going to call a gift from God, the Creator. And the basic one today that we're going to discuss about is the sight sensor. You know, with other senses, you can do each and everything, though we need them, yes, we need all of them, but without this gift of sight, there are problems. Take, for instance, without the sense of tasting, still someone can survive and live a life, well, not to the maximum that one could or might appreciate, but at least they live. Someone that is deaf, they can live and go where they want. But someone that is blind needs help from their homes, from their beds to anywhere, be it eating or be it to go anywhere. They need help from the neighbors. That is why the gift of sight is so special. And what are we discussing today about our sight? We are discussing about a disease that is called glaucoma. And what is glaucoma? The list I tried to search, to make research about, and what I got is that glaucoma is a group of eye disease that can cause vision loss and blindness by damaging a nerve in the back of your eye. The nerve is called the optic nerve. Well, this is the leading cause of blindness worldwide, for your information, and this is the reason as why I had to invite an ophthalmologist in our brother who was with us in the previous episodes, that is Dr. Abubakar Karinachi. You're most welcome, sir.
Thank you very much. I'm humbled and pleased to be here yet for another talk show that I think will benefit the viewers.
Thanks a lot. Thanks a lot. Dr. Abubakar has been with us from the start of the series of this episode, and together we'll be with our later on in the program, of course. He's online and he will be following us till we call him in. That is our brother Hussein Chiyinji, who is an eye clinical officer. He will be joining us later on to help us enlighten our viewer in a few of the questions that we'll deliver to him. Dr. Abubakar Karinachi, let's go straight to the program. Okay. And I would like you to enlarge or enlighten a bit more about glaucoma and how it appears in children.
Yeah, thank you very much. Glaucoma, dear viewers, we should learn some few facts about glaucoma. Okay. In simple terms, we call glaucoma the silent thief of our sight.
A silent thief
of our sight.
It does not come at once.
It does not come with pain in most cases.
Okay.
By the time you know that you have glaucoma, your sight has gone.
Oh.
You don't have sight. And the bad news about glaucoma, if it blinds you, it is irreversible. It's the second leading cause of blindness. Okay. But number one cause of irreversible blindness. Unlike cataracts, where you can do surgery and you see again, for glaucoma, once it has taken some bit of your sight, that sight can never be recovered.
It is gone for good.
So that's how bad it is. So listeners and I myself, glaucoma should be a worrying disease. You asked about glaucoma in children.
Yes, how it appears in children.
It affects many people, including children, though it's common in adults above the age of 40 years and beyond. However, we also have what we call congenital glaucoma that affects young children. They are born with it. The major cause of glaucoma in kids is because of a defect in the development of the system that drains the eye. Our eye has some fluids in it.
Okay.
These fluids are produced and they drain out of the eye. If the drainage is less than the production, pressure builds up in the eye, and this pressure is what causes damage to the optic nerve.
Okay.
Once that damage occurs, it is irreversible. So children are born with that defect in the what we call angle chamber, anterior chamber angle. That's a site in our eyes that the fluid called aqueous humor drains out of the eye.
The fluid called?
Aqueous humor.
Okay.
It's like water. It is produced in the eye and drains through that angle chamber. If the drainage system is blocked, or if it drains less than what is produced, pressure builds up in the eye. So glaucoma in kids, unlike adults, is a bit different. In the young ones, because the eyes are still developing and growing in size, the eyes in kids are a bit stretchable. They can stretch.
Okay.
So a child who has glaucoma will have big eyes because the eye is stretching.
Okay.
This pressure is building up, so there's room for expansion of the eye. So the eye is bigger. For the adults, it's another story. The eye is fixed. It does not increase in size.
It stays on the normal size.
Normal size, so pressure that builds up in adult actually damages the optic nerve faster than in kids.
Sure.
So children with big eyes that are a bit blue and a bit cloudy, that's a sign of glaucoma in children.
We have a problem. Well, parents, I hope you're following. Many of the parents here in Africa, when they see their children with big eyes, they call them glory eyes.
Glory eyes, beautiful.
And beautiful eyes.
Some are beautiful,
bluish.
actually, not glaucomatous, but if a child has big eyes, they fear light, they like indoors most of the time, and there's some haziness on the eye.
Okay.
That's a sign of glaucoma in children. And I told you earlier in the previous episodes that in children, anything that causes cloudiness in vision is an emergency.
Okay. So you need to hasten to see the doctor.
Hasten to see the eye doctor to make sure that we don't lose the sight in the kid.
Okay.
We mind about kids more than adults because someone has 40 years ahead. Someone who is 50 and they are getting blind, we can say they have had enough maybe in terms of seeing. But a young child who has, we call them life years,
Okay.
40 years to live, we don't want to have them live years of blindness.
Okay.
So to the kids, we
It is
mind
an
about
emergency.
an emergency. We heard about amblyopia.
Yes.
One of the causes is glaucoma in kids.
Okay.
Yeah.
Thanks a lot, Doctor. Well, parents, you've heard, with children, you need to hasten, you need to rush, you need to be fast in consulting your medical personnel, especially the eye specialist. Not every doctor can tell you what is happening with your children's eyes. Doctor, when you talked of glaucoma, and when I defined glaucoma and the simple research that I found out, it is this disease that is not alarming as it comes. Yep. It's a disease that now is worrying me a lot. By the time you realize you have glaucoma already, you are blind. By the time you realize it is a disease that is not going to cause pain, it is so worrying in it. So to this reason, I'm asking you, what really causes the disease? Maybe it will help our viewer run a little bit faster to prevent it before.
Yeah, thank you very much. The causes of the glaucoma. We cannot point to exact causes of glaucoma. How it comes about is if there is pressure in the eye, mostly pressure, because we also have what we call normotensive glaucoma,
Okay.
where there is no pressure in the eye, but there is glaucomatous damage on the optic nerve. But the number one risk factor for glaucoma is increased eye pressure. We call it intraocular pressure. So in most cases, what causes the rise in pressure is drainage is less than the production of this aqueous humor, the fluid in the eye. Once there's blocked drainage or the reduction in drainage of the fluid, pressure builds up in the eye slowly. By the way, glaucoma damages the optic nerve very slowly but gradually. It can even take 5 years, 7 years, damaging you slowly. So the major cause is the blockage mostly. And the viewer should know who is at risk of developing glaucoma.
Okay.
Because the cause is not something very important, but we discuss mostly risk factors. Who is at risk of getting glaucoma.
Okay.
If you ever had someone in your family who is declared blind in your family, either an uncle, either maternal or paternal, or your brother or your dad was declared blind, you have chances of having glaucoma also. Because we are shown that this blindness that is not treatable, most likely is glaucoma. So if you have someone in your family who is blind, I myself in my family, I have uncles who are blind.
So should I assume that you are at risk
I'm at risk of having glaucoma. One thing I can do is to make sure I am screened early. By the age of 30, 35, 40, I should start screening every year. Because if you see it early, we can prevent glaucoma development. So number one is family history of glaucoma. If someone is blind, you are at risk. Number two, if you are an African.
Should I say that it can be genetically transferred?
Yes, there's some genetic predisposition to glaucoma.
Okay.
On that note, me as an eye specialist, if I find a patient who has glaucoma, I have to make sure I invite all the relatives above the age of 40 years for screening.
Okay.
If this old man is having glaucoma and is blind, it is my duty to request him to bring all his sons and daughters and sisters who are 40 years and above for screening.
Okay.
The only mainstay in preventing glaucoma is early screening and intervention.
Okay.
So if you have families of glaucoma, you have chances of having glaucoma. Number two, if you're an African.
What is wrong with Africans?
I think our make is different from the other races. African race.
Okay.
Our skin is black. So our genetic makeup as Africans changes the shape of our eyes and this angle chamber that drains the aqueous humor and many things about the optic nerve. So we are prone to developing glaucoma compared to the whites. Okay? In America, glaucoma is common in people of African descent.
Black Americans?
Yes, they have glaucoma. Also the Asians are prone to some type of glaucoma, and also the Hispanics. So me and you, who is seeing us and you're an African, you have more chances of having glaucoma.
We are sorry, but we have to let
so
you
it
know.
means if we combine risk factors, family history of glaucoma, African race, then the other thing is age. As you grow older, you stand a chance of developing glaucoma.
Okay.
40 years and above, chances are high that you may get glaucoma. So if you're an African and you have family history of glaucoma, okay, blindness in your family, and you are old, those are all increased chances of what?
Glaucoma.
Glaucoma. There are even other factors. If you are hypertensive, if you have diabetes,
okay,
diabetes mellitus, that's diabetes, we know. You also stand a chance of having glaucoma.
Okay.
So this factor is what we should think about, that should prompt us to worry sometimes, and also take precautions to make sure we are screened early.
We do the screenings as early
and
as
then we
can.
avoid getting blind.
Okay.
Glaucoma is preventable. The only mainstay of preventing glaucoma is screening.
So our viewer, if you want to remain with that sight, the gift of sight that God the Almighty granted to you, you have to keep on screening, most especially if you are an African, if you are an Asian, just like the doctor has mentioned, and other people that are at the risk of getting this disease. It is this time now that I want to invite in our brother Hussein Chiyingi to tell us or to take us through the signs and symptoms of glaucoma. Brother Chiyingi, I'm with you right now.
Okay, Hussein Chiyingi, an eye care specialist at Saidina Bakal Islamic Hospital. Now, to answer your question, the signs and symptoms of glaucoma. Glaucoma has more than 3 types, and all of those 3 types have different signs and symptoms. But let us talk about the common 2. We have this primary open angle glaucoma, also termed as the silent thief of sight. It is termed that way because this disorder will take away your vision slowly and painlessly without you knowing. And you get to know, or you get the signs and symptoms later on in life when about maybe 50% of your vision has gone. And amongst the signs and symptoms that you get or you may get at that time, there is reduced night vision. You'll be having difficulty seeing things clearly at night. Then another thing is loss of peripheral vision. Someone may be seeing something like looking straight forward, you see everything clearly, but anything that is peripheral, anything that is beside you, you are not seeing it very well. That is how glaucoma takes away your vision in that it starts from peripheral vision coming to the center. So that is another sign, or that is another symptom. Then when we talk about the other form of glaucoma, that is angle closure glaucoma, that is the other type of glaucoma. Now this one, I sometimes refer to it as the best type of glaucoma anyone can get, because it will notify you, and if possible, sight can be saved. It will notify you even before sight going, because it will come along with pain, it will come along with vomiting, nausea. You will feel as if the eye is about to burst. Now that is the second type of glaucoma. It is called angle closure glaucoma. I myself, I always want to refer to it as the best type of glaucoma, because it notifies you that I'm here before vision going.
Okay, thank you so much, Brother Chiinji. Doctor, you've heard him. Yeah. Now let's get to something else. Well, we have seen people at risk. Yeah. We have seen the causes. I'm going to say this, just I've always been saying it. In Africa, spending money is something that is not easy with us. Yeah. By the time we go to hospital, be it eye problems, be it any other disease, we are at the red mark. We are almost dead, right? Yeah. So preventive measures would help us a lot.
That's true. As
prevention is better than cure. So what measures can we take to prevent glaucoma from affecting us?
Well, thank you very much. The viewers on this program should know that glaucoma causes grief to the patient and even the doctors. When someone comes to me and they are blind, they come with hope that they'll get their vision back. After thorough examination and investigations, if you find that you have glaucoma and it has done significant damage to the optic nerve, I feel sorry, because I do nothing much to help you. I have to take you through counseling. Even you as a patient, with your hope are crushed. Your hope is crushed, actually.
Yes.
Because I'll tell you the fact that nothing much can be done. However, we still intervene, and our intervention is to prevent progression of this glaucoma. However, chances are less of recovering what has been lost. So prevention is the mainstay of prevention of glaucoma is the mainstay in managing glaucoma, and early intervention prevents progression and blindness from glaucoma. Actually, people get blind, fully blind. I have stories of my clients who I advise, they come for eye checks and tell them this, I can see damage in your optic nerve, and this is a blinding disease. You have to be close to me for most of the time. Close follow-up. Every month I have to see you. I put them on medication, and if someone goes off medication, after 6 months down the road, if they come back blind. And I feel so bad about that.
Sure.
So prevention is the mainstay. How do we prevent glaucoma? As I told you earlier, screening, screening, screening. Screening is not done by any other person but an eye healthcare worker. An ophthalmic clinic officer, an optometrist, or an eye specialist like me can do a thorough screening for glaucoma. At my center where I work, at the Eye Care Center, if someone is 40 years and above, I have to do a glaucoma screening on them, mandatory, to make sure their coming is of benefit. If they have come for itchy eyes, or they have or need glasses or something like that,
whether they like it or not, they have to.
Because I have to be of help to them. I have to screen. And if someone has glaucomatous changes, because someone has no pain and their vision is good, actually. Glaucoma destroys vision from the periphery to the center. So by the time someone is blind, it means damage is significant. So what I do, I screen them. I even take their eye pressure as a way of preventing glaucoma. So if you're 40 years, even 35 years and above, go for an eye check. Even if you don't have any pain, don't have any visual problems, go to an eye doctor and tell them, I want to screen my eyes for glaucoma.
I feel like coming for a screening.
That's the best thing you can do for yourself. And if you see it early, you can live a life without glaucoma if you're on medication and good follow-up. So screening means you yourself don't wait for doctors to come and drag you to the clinic. Find time, find we are poor, we don't have a lot of money, but your health is your capital.
Okay.
If you go blind, you're useless. Not very useless as per se, but you stop working, you lose your job. So why do you wait for that to happen to you? Yet you can save a few coins and go for a screening.
Doctor,
Okay.
thanks a lot. Let me hope that's the only thing we can do as a preventive measure.
That's the most important thing we can do.
Screening.
Screening, if someone has suspicious changes in the eye that may point to glaucoma, we do some scans to even grade how much damage you have in your eye, and also take you a thorough checkups on your vision and everything. And if you see that you have glaucoma, we start you on medication. And then with that, we can prevent blindness.
Doctor, are there any glaucoma complications?
Of course, number one complication is blindness. I mean, if you have glaucoma, you go blind. And by the way, glaucoma has types. We have what we call primary open angle glaucoma, which is the commonest, especially in Africa here. If you go to Asian countries, they have another one called chronic angle closure glaucoma, because the eyes are small, they have shallow anterior chambers, they have the other type of glaucoma. So this one is painless, no pain. If someone has acute angle closure glaucoma, they have serious pain, headache, vomiting, nausea and everything. This is rare.
Okay.
Actually, in my practice and my training at master's level and my practice, I've never seen a case of an emergency angle closure glaucoma, but it's common in other countries like in Asia. So this is painless loss of vision, and you cannot tell until you're screened. You don't have pain, you're actually seeing well. Okay?
Yes.
We have had cases of a driver who could go knocking people on the way because you lose peripheral vision at first.
Okay.
So whoever is passing on the sides, you don't see them. At another advanced stage of glaucoma, it's as if you're looking through tunnels like this. Imagine having such vision where you're like, it's as if you're using pipes. Eh? It means you cannot see on the sides. Then even that vision also goes and then blinds you completely.
Oh my
So
God.
screening can help us grade the glaucoma, and we start you on medication, and you can save yourself from getting blind. So screening, screening, screening.
Let me
Very
repeat that. Screening, screening, screening.
Very
Our
important.
beloved viewer, screening, screening, screening. Doctor,
Yes.
we have realized we are at home. We have realized that maybe one of our colleagues has got the illness, has got a glaucoma. Is there any first aid that we can do to save that person?
Well, first aid is given to someone with an emergency. Most of this glaucoma is not emergency. The emergency glaucomas is angle-closure glaucoma, where we have to, someone has pain, bad vision, that is but those are rare cases. We have some first aid for that. But glaucoma is not an emergency per se.
But what do we do then if we find out that someone...
The mainstay in treatment of glaucoma is control of the eye pressure. The only thing we treat in glaucoma is to make sure the eye pressure is within normal range. The eye pressure is between 10 and 20. The eye pressure I'm talking about is different from the body pressure we take.
I personally talking, I don't know how to measure the eye pressure.
You cannot measure the eye pressure.
So I'm talking of that man at home has realized, or a mother, or anyone at home has realized that maybe a sister, a brother, or a colleague has got glaucoma. What do they do to save him as the first aid?
I think, as I told you earlier, you cannot have any treatment plans for glaucoma at home.
You have to rush to the hospital.
You have to go to the eye specialist or an eye healthcare worker for an assessment and management.
And the best time to do that is before any signs.
Before any signs. Screening, you screen for that. If you see any signs of bad vision, there are other causes of bad vision. But glaucoma, it's still an emergency. There are a few cases of emergencies, and you cannot manage an emergency
at home.
Thanks
so much, Dr. Abubakar Kalinachi. It's been a wonderful time having you. Our viewer, glaucoma is something that is irreversible. It is causes vision, sight loss, and total blindness, actually. And once you get blind, it is irreversible, unlike some other eye diseases like cataracts. So for the cataract, we saw doctor told us that you can't go for the eye surgery, but with glaucoma, you're gone. So brothers from the age of 35 and above, please go for medical screening and go to only and only eye specialists alone. Doctor, any concluding remarks before we close about program?
Yeah, the conclusion is you can help out someone who has blindness by making sure they seek health attention from an eye healthcare worker. We have diploma holders, we have also specialists. So if you have someone in the village who is blind, help them seek attention. Two, if you have someone in your family who is blind, and you are sure that you are from their family, go for a screening at 35 years of age. If a child has cloudy eyes, big eyes, and they fear light, and something is not okay with their eyes, take them for an eye check. Don't wait for someone to go blind. Then if you are a glaucoma patient, I advise that you stick to the appointments of your eye doctor. Don't lose contact with them.
Okay.
Otherwise, they treat you for some time, then after you lose contact, then you become blind later. So a glaucoma patient is a chronic patient. Never leave your eye doctor. That's very important.
You have to be in contact with your doctor
throughout.
regularly. Thank you so much, Doctor. That's the very reason as to why we had to bring you to our program. It is Healthy Check, where we share some medical advice with you, and I hope today's advice is of a benefit to you and your loved ones. But time can't allow us to go beyond this. We have only 30 minutes for a program. What I promise you that I'll bring Doctor again, maybe to give us more enlightenment on some other eye diseases. But for now, let me put the program to a close. And until we meet in our next program, I remain your host, Nambale Bashir. Assalamu alaikum wa rahmatullahi wa barakatuh.
you